Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's compare the hyperemia and the congestion. So what is hyperemia? Hyperemia is an active process due to the arterial dilation. So there is an arterial dilation. The congestion, it becomes a passive process due to the impaired venous outflow. It becomes a passive process. So it is a passive process. Then moving on to the edema. In hyperemia, is edema present? It is not present. In case of congestion, the edema is present. Then moving on to the color, the red color of the tissues. Hyperemia is nothing but the red color of the tissues, whereas the congestion, it is the blue-red color. It is a blue-red color, and this is of the tissue, and this is due to the deoxyhemoglobin. Now the hyperemia is seen in case of the inflammation. Now the congestion, it is seen in case of the right heart failure. Right heart failure is where the congestion is seen, and the portal venous obstruction in case of cirrhosis. To learn and grow daily like this, please do subscribe.